Good afternoon and welcome to our live Reversing Lifestyle Diseases. Our topic today is something that affects a large number of families, basically autoimmune disease. Now, regarding autoimmune disease, the issue is that these diseases often come under or are related to many specialties. So what happens is it can be something to do with the skin like psoriasis, rheumatoid arthritis or lupus, or even with the kidney like nephrotic syndrome, and likewise. So what happens is it has been and is even now something that is quite confusing to the common patient. Today we have with us, as usual, Dr. Jolly Thomson, who has over 35 years experience in the medical field and focuses on clinically supported lifestyle correction for lifestyle diseases. Now, this time we are trying to figure out how correction of the lifestyle under clinical supervision can possibly help those who are having autoimmune diseases. To begin with, the first question to Dr. Jolly Thomson is, what exactly are autoimmune diseases and why is it that the body would attack its own tissue or organs?
Autoimmune diseases, basically the immune system, our own defense mechanism, is attacking our own cells. Why it is happening? It is actually a misdirection. There is a self-identity, or the immune cells has a self-identifying system is there, but there is a break in that. That is the reason for this happens. Actually, this is well understood with an example. Actually, that is most studied is this celiac disease or the gluten sensitivity. We are very commonly aware about the gluten, wheat and all. So previously we was not knowing about when we are not able to not knowing the real reason, there was no treatment. But now we understand that there is an entity, and if it is proved, just avoiding the gluten containing food will clear the problem. Initially, only the celiac disease was considered as the autoimmune disease related with this gluten. But now we are understanding that many other diseases, especially even the gluten sensitivity is related to non-celiac gluten sensitivity disorders. And now the research shows that even some of the psychiatric manifestations also can occur. And that is actually this one food item. There are other food items also, actually, that is not really well explored. I am basically treating this lifestyle disorders or like this autoimmune diseases with not actually treating the autoimmune disease directly. Actually, we are treating to try to optimize the body. The body composition is our prime importance, and giving optimal nutrition, optimal exercise, and try to avoid toxins. Try to avoid toxin in the meaning that even it may not be, the wheat is not a toxin for the common person, but for some people it is like behaving like a abnormal thing. Just like that, there are other food also behave like that. To find out that, and also the other toxins, reducing the toxin level and giving the body the correct amount of exercise and also the rest, and through that how to come out of such diseases. That is what I am working on.
So that was very interesting because at present the consumption of wheat is increasing vastly, especially in southern India, and particularly in Kerala we come across it daily because the way in which wheat is used is in different forms. So it is very important, according to what Dr. Jolly has now said, that if we are using wheat, and if you have something like suspect some issue with your food, that is, if you may be having something wrong with gluten, it is always wise to have a checkup regarding that. Regarding these autoimmune diseases, it is commonly you are mentioning that most of the patients regarding this topic are women. So why is it that that women are more prone to autoimmune diseases, or is it that they are diagnosed better, or what is it?
So generally, women are considered more prone for it. And we give so many examples, so many assumptions, like maybe because of the hormonal differences and the immunity changes with the pregnancy and all. But what from my studies, I have a very interesting finding that it is basically ladies have excess, more fat than the men. Generally considered, the men, the 10 to 15% of the fat is okay. That is the ideal. And for the women, it is 15 to 25% is ideal. So generally, the women body itself has a fat content is high. So this excess fat is the maybe the problem for excess fat in the generally it is, and even in the men that autoimmune diseases are increasing. I think one of the reason is excess fat gain, which obesity, and this also is related. There are lean autoimmune patients also, but there also the fat mass will be, that is my observation actually. It is not internationally or scientifically. This fat and relation is not generally, if you search in the Google and all, it may not be there. But that is from my studies and my experience, my inference actually, I'm telling. And what is connected, what I understand is that also this is related to omega-3-6 balance also. Not only the, basically I said that in my way of treating, we are not treating the disease, treating the body which is having the disease, and correcting the proportions. And one of the most important is the lean mass fat mass ratio. If most of the patients will be having excess fat, so reduce that. And also inside the fat, there is the omega-3 and omega-6 is the essential fat. Actually, that is the one which is controlling the immune system as such. Generally, there are other factors also coming, but they are the major and the high-end omega-3 and omega-6 fatty acids like eicosanoic acid and arachidonic acid, and all are the controlling factors in that. And that mechanism has to be corrected. And that is what there is an imbalance in that, and that is the reason for increased autoimmune disease, increased chance of autoimmune disease in ladies, and also increasing in the men also nowadays.
So that is interesting to know that there is a possibility that the fat composition, an increase in fat composition could be possibly one of the drivers for autoimmune diseases. It is just from observation, but even then it is a possibility that we should understand. You often say this inflammation and aging share a single background. So what is it that we should understand, especially since almost all these autoimmune diseases present themselves in some form of inflammation. So what is it that generally we should understand, especially those who are having an autoimmune problem?
See, inflammation is actually increasing in inflammation and aging. Actually, we all know that when a child is during childhood, usually there is no diabetes or hypertension and such lifestyle diseases are not there. That usually in the old age, like after 50 or 60 or 70, it comes. But it has changed now. Now even the children is having the autoimmune disease and even the diabetes and hypertension and all comes even in the age of 12 years, 14 years, 15 years, 16 years and all. So for example, to show you that inflammation, I'll give an autoimmune example itself. This is a lady. She is only very in the early 20s, in 22 years only, and she was found out with the SLE, diagnosed with SLE, and it is actually immediately after her childbirth. The child is only 4 months old, infant. So what happened is actually she's having joint pain and very much tiredness, low grade fever and all. They looked into, and the ANA was positive and was under treatment for the rheumatologist. DNA was positive, 613 was there. And when she came to me, when she was taking so many medicines, but she was not getting relief. Actually, she was treating on methylprednisolone was there, hydroxyquinone was there, and Omeis and Kenacort, that is triamcinolone injection was there. With that all, she was not getting enough relief, and she was asked to stop breastfeeding and then come for more injections. That is rheumatology department has asked her. In that stage, she was come to me. She was very upset about stopping the breastfeeding. So the child is so young, and also she was uncomfortable with all her discomforts. And when we give a body composition analysis also, and also a detailed checking, and what is found that she's her height was 163, and her body weight is 76, and her she's only 22 years, but her body age is 44, double the age, and also visceral fat was very high, 6.5%. So when we started treatment, within 15 days we were able to come out of all the medicines she was taking, and usually within 15 days we can see marked symptomatic improvement in most of these patients. And by day 90, she was able to come down to around the body weight around by day 90, she was able to come down to 60 kg. So when the excess fat is also gone, and her body age also came down to 30 by that time. So that is basically the inflammation and the fat content is connected. And just to note weight reduction, the fat has to go, and also the body has to be given enough nutrition and the exercise, and then the things will get corrected. So at this age, otherwise she has to live with SLE for the lifelong with medications. When it is started, the weight will be again increasing because all steroids and all will be, all this medication also aggravate the weight gain. So that also, the inflammation also, with the weight gain, the inflammation also goes up.
So for anyone watching this channel for the first time, they may not be knowing what is this health optimization program called CSLC-CAP. So can you explain briefly, for such viewers, what is this health optimization program?
See, this is basically a modern based medicine based. I'm basically not a rheumatologist. I'm talking about the autoimmune disease, but you should understand that I'm not a rheumatologist. I'm basically I'm trained in the reproductive medicine. I was concentrating in the infertility treatment, and from that, when many of the patients, even though we do everything for the infertility, IVF and ICSI and everything, but many won't get conception, or there may be even they conceive the early abortion, late abortion, congenital abnormalities, and so many problems can occur. So when I started doing this health optimization, or the correcting their body, the result is easier and better result, and even those who repeated abortions or failed repeated IVF, they're able to conceive without even much of the treatment. It's infertility treatment. So from that, I have understood, and it is then gradually developed. And basically, in this, what is focused is to give optimal nutrition and optimal exercise. It's all these SLE patients or the arthritis, rheumatoid arthritis and all, they cannot do much of this gym sort of exercise and all. They cannot do. Even they cannot even won't be able to walk. But in the lying down position, sitting position, they can do a special type of exercise pattern as for the patients itself or sick also can do. And see that this basically focusing on this, many of these patients will be obese and the excess fat will be there and it has to come down. So a low calorie diet, but all the nutrition in the correct portion, and also focusing on the omega-3 as its balance correction and to reduce the toxic load of the body. So basically, our immune system is our real doctor. The doctor or the hospital or operation, it can only help the immune system. If you are getting a wound, when it is closed and it is the anatomy is corrected, it is helping the immune system to rebuild make the body to regain its real nature. So the real doctor is your own immune system. To empower the immune system is the work in health optimization. It doesn't mean that it is autoimmune disease or a metabolic disorder like diabetes, hypertension, or heart disease. Usually what we see is all these things will be together, or one single patient will be experiencing many of these things. Usually the treatment is on disease based, but this is not disease based, this is body correction is the pattern. So everything will be getting a reduction according to the patient's effort and also the body's capacity to regenerate or repair. So that is the difference between the both. It's basically healthcare and health optimization. The other thing, conventional medicine is basically medical care and or the surgical interventions.
See, reducing chronic medication is one of your goals. You always say that, we try and reduce medication where possible. So generally, those who are taking medications regularly, even if it is 1 or 2 or 20, they will always have a fear that, if you are reducing medications, because my medications are being reduced, will my disease come back? So what is it that, you have to say regarding that fear?
See, one thing we should understand that this medication is mainly focusing on the symptomatic relief. For autoimmune disease, the problem is inflammation. Our own immune system is attacking our own body or cells. So in that, what we do, what the medicine do is usually the immunosuppressant or immunomodulators are used. So they are one or other way suppressing or manipulating the immune system. So definitely the immune system, immunosuppression, we all know that heavy immunosuppressants, the risk is infection, one of thing, and also if long-term use, the cancer possibility is there because the body, the immune system is protecting the removing the damaged cells. The accumulation of the damaged cells or the DNA damage is leading to the cancer. So if the damaged cells are not, these abnormal cells are not removed, they will multiply and they will take over the control. And the cancer spread is coming. So the immune system has to be empowered. That should be our aim. That is the aim we are giving. And I'll give an example of this one patient who is having multiple autoimmune disease, who was on multiple medications. And this is a young man, only 43 years, and he's having many metabolic disorders and also many autoimmune diseases. He's taking medication for ulcerative colitis. thyroiditis, that is Hashimoto thyroiditis, and also he was diagnosed with ILD, that is interstitial lung disease, and arthritis, spine, and shoulder pain and all is there. He had already undergone a angioplasty. Diabetes is there. So multiple medications. He's on thyroxine to 125 milligrams, Celcept, Sompras, Misacol, Abiflo for the lungs, breathing difficulty is there, prednisolone, Concor, Pragerin, Rosuvastatin, Telecast, and so many medicine, and also some supplements, and also homeo medicines he is on. This patient was able to come out of medicine. Usually the 90 days, we are intense follow-up and monitoring will be given. And most of the patients, they can come out of the medications within 90 days itself. And this person also, that body changes is the most important marker what we are looking into. With this, not just weight reduction, only the fat reduction. That is very, we should understand that. And in this patient, he was 170 centimeters and 69 kg. And within 3 months, he was able to come down to 52 kg. And his fat was 8.5%, and by the time it was visceral fat, not the fat, visceral fat was 8.5, and it came down to 3%, and the body general fat was 23%, it came down to 14.9. So that is the body composition is corrected, and only that by the time 90 days, use even the thyroid hormone, which is with the for the Hashimoto thyroiditis also was reduced to 25 milligram. That because it has to be gradually, to take some more time for the immune system. But by the 6 months, he was able to come out of almost all the medicines. So that is the thing. So it is not the metabolic disorder or autoimmune disorder. It is actually the inflammation and the body markers which is we are directing into. And if the patient is following it correctly, they will get. But well, another thing is if the patient deviates and they gain weight or they are taking those food which is not suitable for them. He also had so many intolerances or allergies towards food like milk products, even potato, oats, rice, that is the common staple food here. That also he was allergic. Those things he has to avoid. And tolerance also we have to check, and that is the thing. So if you are go ahead with the monitoring, the medicines you should not stop by your own. It should be with the monitoring and intense monitoring, and always the patient should be in contact. And the under monitoring we can reduce. That is safe.
When you are mentioning about this health optimization, you were saying, that 2 weeks or 90 days or 6 months and all that. So, what exactly is the pace generally? Because it will be different for different patients. But even then, generally, what is the time scale for this health optimization that you are talking of?
See, the health optimization is based on basically it is focusing on the body cell turnover. See, every day so many cells are dying and new cells are coming. The body is always changing. We know we are from two half cells, one zygote is formed, and that one single cell is divided and the baby is formed within 10 months, 90 to 80 days. And that small baby is growing up to this full adult size. It will be around 50 trillion cells. 30 to 70 trillion we are generally saying. 50 trillion we can take. So these 50 trillion cells are not static. It is always changing. In that, this immune system related cells are having a fast turnover. This WBCs, especially when you are having a disease, it is a turnover will be within less than a week. And even the lining of the respiratory tract, intestinal tract, etc., will be having less than 2 weeks only. So that turnover time is the most important for even the symptomatic relief. And we will be very unbelievable. We will feel that just how fast it is the symptomatic relief itself is getting. More in my experience, all these SLE patients and this rheumatoid arthritis and all, they get a fast symptomatic relief because this immune cells turnover is very fast. Within 2 weeks, they get reasonable. I'm still not saying that everything will be corrected. No, not everything. But they'll comfortable, usually within 2 weeks, they become comfortable. Within 1 month, most of the medicines, especially in the metabolic disorders and all, it will be reduced to many medicines can be reduced, and especially the steroids and all. But the steroids we cannot stop abruptly. None, or we should be very, very careful about reducing the immunosuppressant dose like steroids, because there is adrenal suppression and all is there. So we cannot do any of the hormones and all, which will be only gradual withdrawal. That is only with the improvement in the symptomatic relief, and it should be gradual. And another thing is 90 days. This our RBCs, our red blood cells, is the lifespan is 90 to 120 days. So around 90 days, almost 80 to 90% of the cells in our body is replaced, because the most huge number, when you consider the number of cells, that is blood cells is the WBCs and the RBCs and the major part. So almost 90% of is replaced. That is why even that is HbA1c calculation or HbA1cs depend on that. By 3 months, we almost 80 to 90% is replaced, and so the health is different. That is the importance of this 90 days. Always we give the patients strict 90 days follow-up, and then gradually reducing the support, and by 180 days they will be almost set to manage themselves.
Actually, in this health optimization treatment, you say that testing is something that is very important. At the same time, generally patients are worried about tests because they think the tests are expensive, and many a time they think it is not essential. So how do you see the importance of testing, and what is it that patients should understand, especially if they have to understand their condition better?
See, tests are important, definitely. Everyone knows that it's only, you cannot just by watching, you cannot diagnose, but we can diagnose many things by watching, by the changes in the skin color, even this SLE. Systemic lupus erythematosus, it is butterfly rash is the fundamental one of the manifestation, but that is applicable only in the fair skinned people. If the skin is dark, it may not be evident. But we cannot give treatment depends just on the butterfly rash. We cannot diagnose it's SLE. So we had to do the test like ANA, and the different splitting 17 or 18 17 type of anti-nuclear antibodies are there, and according to that we come to a diagnosis. So for health optimization or the correcting your body composition, you need much more. Just a diagnosis of SLE is not alone is not sufficient. We had to see what all food it is you are intolerant or allergic, and also we had to see what is your condition of your immune system, and whether your other rheumatoid arthritis sort of arthritis problems are there, and what is your condition of the heart and kidney, liver, etc. So we need a detailed analysis, and that cost reasonable cost will be there. But when we compare to other, there are so many other expensive for the cancer and all, for the gene study and all. It's very expensive, even if costing in lakhs. But compared to that, it is much lower than that. Really, it is not that expensive. And even the treatment, it's a medication. It's many a times there are cheaper medicines is there, but the latest this biologicals and all is very expensive. But here only the nutrition and this basic test. But after that, when only we are when the during the course of the treatment, we just see all what is abnormal and whether it is coming down. That also, if you are too many abnormal tests are there, then you have to spend more on the test. But if you have less number of abnormal tests only, then less amount will be there. So that, but we had to, in the health optimization, we had to see what is the condition of the body, not from the symptom alone, but in detail we had to understand. And then we had to correct it. That is actually because many of the patients, only very few in the initial stage only, oh, why, how much, this is too much cost and all. But usually when they understand, their patient is more interested in doing the test. Before coming itself, they'll do in their own neighboring lab also to see. There are also patients are also anxious to see, many are, to see what is the difference, especially if liver enzymes or the kidney function is upset. Everyone will be very worried. So they also, independent of the clinic, our prescription test, they themselves also do. That is possible in India because it is, especially the test, you can do it your own, and also it is test is comparatively very cheap, economical here compared to foreign Western countries, because we have patients from there also. They find it difficult to do the test. It's very simple and it's easy, and we can do because more economical. You can do it freely here, and it is very reassuring for the patients also.
So tests look very complex, costly, or to even some unnecessary, primarily because they may not even understand why these tests are done and what is the benefit of these tests to are used. The next case, what we would like is to see a run through of, what if a rheumatoid arthritis patient comes to you who has multiple other issues. Usually all these autoimmune diseases will be coming as more than one, and also they may be associated with other metabolic diseases. So when they come, they will be having their own burden of many different types, including multiple medications, and they will be having their own distress situation. So in such a situation, how does this clinically supported lifestyle condition, play with their treatment, especially when they may be having getting themselves treated with many different specialities. So across specialties, how can you involve?
See, basically, we are treating now this health optimization is for the body. It is not focusing on a single disease. That is the difference between the conventional modern medicine treatment and this health optimization. This is also modern medicine based and fully, that is evidence based. That is why we do all the test and progress assessment, not only the symptomatic assessment, only where the progress assessment also in the with the testing itself we are doing. I'll give an example when it comes to across the specialties when you are asked. I'll give a patient an example. I will explain it with an example. This is a 70-year-old man, and he is on many medications, almost so many medicines, and his autoimmune, yes, he was diagnosed with SLE, and also he was having arthritis of the shoulder, and this autoimmune arthritis is there, and ANA positive, And he was asked for knee replacement because of the osteoarthritis. And he had a heart attack, and one stent was already applied, and cardiac medicines is there, and hypertension is there, 3-4 medicines for hypertension, allergy is there, and lung problem is suspected of interstitial lung disease, and the scan also shows the evidence for the interstitial lung disease, and COPD, that is COPD is there, liver there is. So it is at this age, he's almost all the systems is affected. When we looked into, actually he was not having an angina sort of pain or anything, but his troponin also was high. He was on medications like meclofenate, that is a very strong immunosuppressant, and hydroxyquinone, Visalone. And for the prostate, he is taking 2 medicines, that Flomax, that is tamsulosin, and for the BP, he is taking prazosin, olmesartan, metoprolol, nebivolol, and rosuvastatin plus clopidogrel medication is there. And for the respiratory problem, inhaler was there, Maxiflow, that is formoterol and fluticasone, and antacid, this acidity problem, rabiprazole is there. And so many medicines at this age 70. So you understand how difficult it for him to even take it and eat it itself will be a major problem for him. So this patient actually was also come out of that he was symptomatic relief was by the 8th day itself, patient will start reducing the medications, was gradually reducing the medication, and by the day 90 he was come out of most of the medicines, but his he was only the Nicardia tablet he was able taking. That is, actually he was by the all the other medicines we are not able to tolerate, and he changed over to Nicardia, and the BP was not coming down, and his again his cardiologist also was consulted, and he shifted over to Nicardia. That itself is not continuously he was not needing. Only once when there is stress or any problem is there, if the BP is going up, he was taking Nicardia. All the other medicines he was able to come out by the end of actually not by 90 days, by 150 days. That was the thing, because he has so many medicine, it was very slow. For the BP medicine, it was some difficulty was there. That is why the cardiologist also was involved. And that is it. Even this my fatty liver was reduced. This prostate, we reassess by 3 months. We reassess if there is fatty liver or prostate enlargement is there. We are assess that also, and also we should understand the change in the body composition. He was 79 kg and came down to 63 by the 3 months, and by keeping around 61 by the 180 days. And the fat is reduced, and he was able to knee replacement was asked for knee replacement. Freely he was able to walk. There's no any pain. So symptom wise, he's completely out from the symptoms, and also his body age. That is also his body age. His real age was 70. His body age when we started is 70, and he came down to 52 years. And he feels the change in his age factor also. That is the patient will himself feel feeling much younger and free.
Actually, when we talk about this autoimmune diseases, fatigue is one of the biggest markers of that. And thyroiditis and fatigue go together. It is so common. What exactly is it that, those who are having that issue, what is it that they should understand? Because generally it is something that, changes the person's life.
In autoimmune disease, the first sign will be usually the tiredness. See, there are four cardinal signs of inflammation. Actually, basically, it is inflammation. One is fever, next is redness, pain, and swelling, and tiredness or loss of function. That is what we are in the medical field, we say loss of function, or we can say tiredness. And in the tiredness will be varying in the grades. All the symptoms of the grade will be mild fever to high fever. Depends on the disease also. In the rheumatic fever, the fever may be high, but in rheumatoid arthritis, the fever may be low. So that is the difference. So when you're abnormally we are feeling tired, you can definitely check into what is the problem. And in our usual scenario, our physicians, usually the doctors will immediately when you're tired, look into thyroid function. Not only actually in thyroid function, if it is normal also, you should look into ATG and TPO also, that autoimmune antibodies. Actually, the thyroid function comes down only very late. This autoimmune antibodies we can, because we have a very reliable autoimmune antibodies in the thyroiditis we have. So you can look into that also. If you are tired, not just stop with the TFT, look into this autoimmune markers also. That is applicable for many diseases also. If you have joint pain, definitely RF factor and anti-CCP and all we will be looking into. But in the thyroid, that is very common for the, in our part of the, where I am practicing in Kerala, is a very common diagnosis. And also we should understand that for the Hashimoto thyroiditis, we see that only in the general this endocrinology and treatment, we give not immunosuppressant for the autoimmune, the Hashimoto thyroiditis, what is given is thyroid replacement. Thyroid hormone is low, so give the thyroid, ease the thyroid by giving the hormones artificially. But in my experience, if the patient is growing correctly, we can come gradually reduce the dose of the thyroid hormone, and many of the patients are come out of it. Maximum, if the patient is the following patients, maximum they may be needing a lowest dose for if they are taking 125 milligram, it may be 25 milligram for maybe an extended period. So most of the patients, I cannot say that it is everyone, but most of the patients can come out of this thyroid replacement actually, or at least reduce the dose to the minimum and much lower dose. And but we should understand that it's very difficult for the autoimmune antibodies to come back to normal. But autoimmune antibodies also come down, and many patients that also, especially in the early stage of disease, very if you are after diagnosis and the early diagnosis and early treatment, even the autoimmune diseases antibodies can come to normal. But again, if you relax and if you are not doing exercise and you are doing weight gain and you are using intolerant food or allergic food, or you are using so much of cosmetics and or the other toxins or the food with food additives, then this again it will revert. That we should understand. Health optimization is not permanent. It is it has to be continued also. You should learn it and practice it. That is the importance of it. And if you once 3 months and then forget it, then you will get it back after 3 months, 6 months, or how much your body is every day changing. You optimized it by 90 days, it is a reasonable level, it is corrected. But if you are ignoring, it will recur.
See, another seemingly not connected issues are the psoriasis on the skin, and slowly it develops as joint pain and then psoriatic arthritis and all that. So, regarding this, those who develop psoriasis initially, they try to manage it as a skin issue. So what is it that they should understand also regarding this connection between psoriasis and autoimmune disease and psoriatic arthritis and other metabolic diseases that also usually come together?
See, psoriasis, psoriatic arthritis, and all it comes from the inflammatory diseases only. It's all related to immune system basically. Whether it is purely autoimmune disease or it is not. So there is, in the medical field, there is a confusion that whether this psoriasis is purely or not autoimmune disease, or this arthritis is rheumatoid arthritis is already established in the diagnosis that category. But in clinically supported lifestyle correction or the health optimization, this whether it is autoimmune disease or whether it is another type of disease is immaterial actually. What we are our focus is not on the disease. We are focusing on the body and the immune system. We are trying to balance the immune system. Immune system is out of order. That inflammation level is high and the repair level is not happening properly. So that is actually connected with the this omega-3-6 balance. We are trying to correct the omega-3-6 balance also. And for this, I'll give you an example also for the psoriasis patient. This is a young man, only 33 years, with psoriasis for the last 10 years, and the joint pain started only for the last 6 months. And he is 174 centimeters and his weight is 79.9, almost 80 kg. And this person, psoriatic lesions are severe, and when we looked into his many nutritional deficiencies are there. He's already pre-diabetic, HbA1c 6.2, HSCRP and the cardiac markers, HSCRP and the homocysteine is high, ESR is high, even uric acid is high, complement also is increased, complement C3 is there. So multiple actually it's arthritis, his anti-CCP and RF factor and all is normal. And when we with the treatment, actually within 3 months he came down from 80 to 68 kg, and he was by the time he was totally symptom free, and he was medicine free, and he was able to manage everything correctly. So he himself is feeling fit. That is the thing. And so for his height, the maximum weight he can have also is 68 kg for the 69 kg for the Indian population, actually the South Asian population. So see that even if it is psoriasis alone or the arthritis also, it doesn't matter. It will come down when we follow it correctly. But this, even if by 3 months it is corrected, but if you don't follow it, it can recur also. That is the point every patient also should understand, that not to stop with this and just maintain it and optimize it and try to maintain the condition and recognize, and we teach them to recognize the early if there is any sign of flare-up or any recurrence is there, find out it early and how to manage it also. It is
another relatively less common, but even then, something that impacts the whole person is lupus. And now patients are getting more and more aware of it. So in this new, more informed situation, what is it that they should know about how health optimization is important for them?
See, systemic lupus erythematosus, or we generally simply say it is lupus. So it is very common condition we see nowadays. I had given an example of in the beginning of this discussion. We have saw a patient with SLE. Yeah, was diagnosed at 22 years, and how it is immediately after the diagnosis she come for the lifestyle correction, and how it was changed. Actually, it was within 3 months she was totally symptom free. Actually, by the first month itself she was symptom free, and he optimized her body composition by 3 months. So another patient I'll tell you to see the difference between the different cases. This is a patient who came to me after 15 years of diagnosis of SLE, and she was on from that day onwards she was on medicines, and she had even that clotting problem was also there. Some in 2003 or so, some clotting brain problems also was there. So she was on anticoagulant, that is warfarin she was taking, HCQ, Celcept, Cevilan, that is that is for the phosphate. She's in the renal failure actually now. She's in the grade 5 renal failure. When she came to me, actually he was advised for the dialysis and renal transplant. That stage she is coming. 15 years of intense treatment. And she was also asking me, doctor, why I am taking the medicines from the diagnosis, I am taking, following the doctors fully. But why I am I went into this renal failure. And along with that, she was taking the other renal medicine like soy bios, sodium bicarbonate, Sompas, that is gastric acidity problems, and also she is inhaler. She is asthmatic also. So in that, say that is actually diagnosed but treated properly in the conventional way, but end up with the renal failure. And for this patient, when we looked into, even though she is under care of the nephrologist and the rheumatologist and all, but her vitamin D is very low, only 9.5. She's already diabetic. Insulin levels very high, 70. And pancreas, there is inflammation is there. Amylase and lipase is high. Creatinine is 6.2. And sodium level is low. Potassium level is okay, but the sodium also is low. And ESR is high, anemic 9.4. It's all common with this sort of diseases. Immune system is also depressed. And homocysteine 23, that is cardiac marker, is high. AN is 87.5. This patient, actually, when we started with the clinically supported lifestyle correction, within the 8th day, by she came, creatine came down from 6.2 to 4.99. And even more microalbumin was there, that also came down. And basically, we were able to bring down her creatinine to 4.4, 4.5, that level, and she was able to avoid immediate dialysis and all. Her symptomatically, she was able to come out of all the medication other than this warfarin. Warfarin is for the coagulation disorder. It's very common. It's very difficult to, there is not a marker for that. So only if the patient is maintaining very well for a long time, at least for a year, we can think of reducing it with the consultation with this other specialist also. Other medicines she was able to come, this immunosuppressants and all, she was able to come out of it. And her weight also, she was 56 kg when she was in the beginning. And by 90 days, we came down to 46, and she was able to she was not even looking after to do the routine housework or the care of the child was very limited, but he was able to maintain that. So that is the difference. It's always better. This kidney function is come down, but we cannot change it to bring it to normal. So it is very important that along with this traditional this immunosuppressants and all, correct the lifestyle with the clinical support and come out of medication, then the progression of the disease can be at least reduced.
Regarding this, women who are actually can possibly become pregnant or are planning a pregnancy, when they have autoimmune diseases diagnosed already, what is it that they should try to understand? Because many of these treatments are actually having so-called strong medications.
See, for the pre-pregnancy planning for the autoimmune disease, if the patient is having an autoimmune disease or taking medication, before pregnancy itself, they had to, or any other disease, if you are on medication for hypertension or maybe the hypertension, the reason may be a hidden IgA nephropathy. So you are not aware of it. All the autoimmune diseases will not show initial symptoms. There may be slight tiredness or such things only will be there. So if the hypertension is also, you should look into GFR or micro RBCs in the urine or microalbuminuria also. So if it is there, when you are getting into pregnancy, and it may flare up and it can be a problem. So always before your pregnancy, you should have a detailed examination and see that you should, in my opinion, all the pregnancies should be after proper planning, and the husband and also the wife, because the egg and sperm decides the health of the baby. So the healthy egg and healthy egg is a primary requisite, and also the baby is developing in your mother's womb. The mother's food, mother's blood, the baby is getting everything from the mother's blood, and what she eats and her health condition is very important. So not only the mother, both the father and mother, or the husband and wife, should have health checkup and understand their health status and correct it and optimize it. And if the mother is entering with even Hashimoto thyroiditis, very common, and no one considers it as a disease in our part actually, and they just take it's a very economical medicine, that is levothyroxine. Just take it and leave it and forget about your having a autoimmune disease there. So if you are even having an autoimmune disease like Hashimoto thyroiditis, you should try to come out of this medication and also to bring down the autoimmune antibodies. Otherwise, the chance of getting this abortion is high. Getting the pregnancy, it may be a problem. Getting abortion is high. And also the pregnancy complications like pregnancy-induced hypertension, pregnancy-induced diabetes, and IUGR, the baby lobe intrauterine growth retardation, and so many preterm delivery. The chance of preterm delivery or preterm cesarean will be high, and the baby in the NICU, and the neonatal problems and all will be high. So plan before pregnancy and come out of diseases not only with the health optimization, whatever problems, even if you are overweight also, you can come out within 3 months with the proper monitoring. If you are in our setup, actually we are reduce 15 to 20% of the excess fat, not just weight reduction. It is only the excess fat reduction we are advising. So you can get into go to pregnancy in optimal health.
Now, regarding health optimization, anyone can feel that health optimization is good for anyone in any stage of health, because that is generally what is the opinion. But you're of the opinion, you say that, because this health optimization program is a very structured program, it requires personal involvement of the patient and an environment also suitably and all that. So, which type of patients cannot actually get included in this program?
For the health optimization, what we are following is CSLC-CAP, that is called clinically supported lifestyle correction with a cell activation protocol for health optimization. This, if someone is underweight, we are actually increasing the weight to optimal level, or someone is overweight, reducing to normal. There are this youngsters comes for before marriage, they want to optimize health. So, or before pregnancy, there are ladies and the husband and wife are coming for health optimization. One may be overweight and one may be underweight, or both may be overweight. So that is the correction. When we look into, there will be so many other deficiencies, nutrition deficiencies will be there. There may be metabolic problems, or this pre-diabetes and such problems may be there. So it can be corrected. And the first important thing is they should be willing for the this correcting the lifestyle. That means you have to understand your body and your food habits has to be corrected. And we will be with the investigations, and also by we give directions, and you should be willing to follow. If I can't do any change in my food habits, I want to eat all the junk food and I don't want to do exercise, I am lazy, I am foodie. If you are thinking that that is all good, but if you are looking for a change only, you can come for this setup, this health optimization program. Next is, if you are very sick, if you are in the ICU, or you are very sick and you are in severe pain, we need a hospitalization. In that stage also, you cannot attend. The most important thing is renal failure. If the kidney failure patients, the problem is you cannot give food, the optimal food for a kidney failure patient. If it is up to renal failure, it is actually you should find out the kidney problem at the earliest. So everyone, in my opinion, everyone should check for a GFR and see your kidney function, because even the people with 30 years and all comes with the age of this creatinine 7 and fifth stage of renal failure. So it is very heartbreaking. Young people is coming with all of a sudden in early 30s or late 20s and all. Knowing that they are in renal failure, it's very heartbreaking for the patient, and also it is very uncomfortable for the doctors also. So to check your kidney function, that is if the kidney function is not it's very end stage, then you cannot give the proper food. The protein has to be reduced and the potassium has to be reduced, and they may not be in a position. So yeah, especially if the creatinine level is more than 5, it is very difficult. And also multi-system failure. If the kidney is also failure, the heart also is in the problem, then it will be very difficult. So otherwise, if the patient is ambulant, patient should be stable with any age, not any age, below 10 years also we cannot, because it is not possible for the young child to be taken to understand the lifestyle correction. In the minor people from 10 years to 18 years, if the child minor people is taken, then one of the parent also has to come for the enroll for the lifestyle correction. Otherwise, it is very difficult for the children to manage themselves. And also for the old, very reasonable health is there, but their memory or the physique, they need support. Then also one of the close relatives, like after a stroke or dementia is there, then also if the patient is reasonably in this Then again, our support close relative has to be enrolled.
Okay, with that, we come to the end of this live. In our poll that we conducted, we found that actually almost 50% of the respondents felt that lifestyle is very much a part of getting things right as far as autoimmune disorders are concerned. But the unfortunate thing is, though they knew about it, they were not aware of how to go about it, because generally the medical system is more focused on treating, utilizing medications and other procedures. So I hope that this talk has given more of an idea about this aspect of correcting lifestyle. Now here the immune system is not the real issue. It is the immune system has worked in a wrong way. And so the understanding that we got in this talk is that to help in such a situation, it is important to optimize the biology of the body, and that can actually help in such a condition. Next, we understood that inflammation is the biggest issue across all these autoimmune disorders, and this stretches on to even lifestyle diseases. So, handling inflammation is a very crucial part of managing autoimmune diseases. And thirdly, we understood that when we need to understand the benefits of treatment, it is essential to look into testing and lab testing for checking out that the improvements are actual, rather than just depending on symptomatic improvement. Symptomatic improvement is very important, but testing is also has a very crucial role in this. We were able to go across with some examples, but we should understand that the examples are of particular patients. It may not be like the same results can be expected for others. So the important thing is, regarding medications, we should be very careful that medications should not be adjusted or corrected or stopped or done in any form by patients themselves. It should be done only under medical guidance. No changes should be done just by having a feeling that I am getting better and I can stop it or something like that. So medical guidance and medical supervision is essential for managing medications, chronic medications. Now, the next week, Wednesday, we are having a live on the subject of cancer and you, because basically we are trying to explain two aspects. One is recurrence of cancer, and then what exactly are the defense mechanisms of the body, because only when we understand what are the body's defense mechanisms, then only we can try to figure out how to best protect ourselves. So next week, Wednesday, 3 p.m., we will be coming with this topic. And if you have any questions or anything to ask regarding these matters or today's matter, for that case, you can always send messages on the mobile number that is coming over after my talk, and you can send it on the WhatsApp. Thank you.